This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Hello, everyone, and welcome to Health Watch here on Talk Radio 1210 WPH.D. My name is Paul Perillo, and I want to welcome you into this special program as we welcome our good friend, Dr. Molly Fantasia, to the program. Dr. Molly, of course, is a good friend personally, and she's been on the radio for quite some time. And the information that she brings to us via the airwaves of 1210 WPH.D is so valuable, so important. And if you are looking for something different in respect that you're just tired of the same old, when it comes to your medical treatment, you go and you see your doctor. Maybe you see the doctor for maybe about 3 to 5 minutes and you come out more frustrated coming out of the appointment than going into the appointment. Dr. Molly is here to take care of you. Dr. Molly, it's so great to speak with you again, and welcome to Talk Radio 1210.
Paul, I want to tell you that I feel like I'm the luckiest gal in the world. I have a great co-host. I have you on one side, on my right side, and I have John DeMasi sitting here with me, and I just want to thank you for doing this with us because John went through a little bit of a health scare, as you know, and I was just thanking God that he was under our care, my good doctors and myself. We're getting him back to the pink, but thank you again for helping us through this time. I really mean that, Paul. You've been a good friend of mine and a good friend to letting people know about some alternative ways in order to improve your quality of life. And, of course, that's the way we are. I think, Paul, one of the things I want to talk about today is how we are a little different than most primary care practices. Of course, we are a cooperative, and all the healthcare providers work out of my facility, which is a licensed primary care facility in Marlton, New Jersey. And we go back about 26 years. I have to say that because there are so many new people jumping in the game of hydration today that are spa-like. Well, we are as far from a spa as you can be. We truly believe in utilizing traditional medicine, I mean Western medicine, which means pharmaceuticals, as well as all of God's ingredients, the nutraceuticals. So that's probably the fundamental difference, and that we use hydration as the vehicle to deliver these nutraceuticals, Paul. And that really makes the difference in terms of what we do. So I think some of the things we need to touch on is, why do we deliver with the hydration? And I know that you are very familiar, Paul, with nutraceuticals because for years you were a spokesman for products out there that we all know and love, and many of my patients use them. So I think we want to talk about why is hydration a good way to utilize nutraceuticals. It's a good way to utilize nutraceuticals because it's a direct delivery system. And today I'm going to talk about a breakthrough in the delivery system as related to anti-aging and maintaining overall good health. So that's where we're at right now, Paul.
All right, that's fantastic. And, for me, as well as so many other people that are out there, we may have listened to the show before, may have met Dr. Molly, may have even called the radio station and got on the air with Dr. Molly. And we'll open up the phone lines in just a few minutes here if you have a question for Dr. Molly Fantasia, the PhD doctor. The work that she does, and I have to say, speaking personally here, when you make a call to her center, you are welcomed in. You may be a total stranger, but everybody on the phone, from the minute you pick up the phone, you decide to call Dr. Molly's facility, you are welcomed in not just as another patient, another client, but you're welcomed in as family. I have to really say, when I reached out to Dr. Molly a few weeks ago, and, whoever was answering the phone, and I've talked to a number of different people on the phone there, they welcomed me in like I was, like royalty, if you will. I mean, and that is so important, Dr. Molly, because, a person who finds themselves seeking alternatives, seeking answers, seeking help, the last thing that they want is to be, pushed aside and just, put in as like part of the herd and just walk through the system.
Yeah.
Your staff is absolutely fantastic when it comes to simple questions, more complicated questions, and getting to the point of what you need.
Well, I appreciate that because I think we've worked hard to do that. And I can tell you that the family atmosphere is absolutely true. No matter how many patients we have, John always likes to sign off with saying a special hello to all the nurses and all the techs. And the fact of the matter is, it's very personal, and it's personalized care in that every single nutraceutical that we deliver has already been manufactured, so to speak, or actually made under spec by our facility, so just for us. So you're not just going in there and you're getting, a banana bag, which they use for people who've had a little bit too much to drink. We're really looking to effectuate the change necessary for people to have quality of life no matter what their medical challenge is. And I got to tell you, my staff is an integral part of that. I couldn't do it alone, as you know.
Sure, absolutely. 855-839-1210 is our phone number here to reach us here on Health Watch and to speak with Dr. Molly Fantasia. 855-839-1210. You could also use your cell phone. All you have to do is push pound 1210. The phone lines are open, so maybe if you want to get in nice and early right now, talk with Dr. Molly. We'll have plenty of time to get to your situation. And what's ailing you. And if you want to offer a testimonial, we love those testimonials as well. You could call in and tell us how your experiences have been with Dr. Molly Fantasia and Innovative Medical Associates. If you want to call, and I believe this is the case right now, Dr. Molly, you have somebody on standby in the office that if you would like to make an appointment to get in to see Dr. Molly, you can call right now and schedule an appointment. Is that correct?
That's absolutely right. Fran is standing by to take your call and has been actually all through the weekend. And believe it or not, we've gotten calls to set up some free consults starting tomorrow. And believe me, I'm going to be there, as they say, with a smile and happy, because I'm thrilled that we have this program and that we're back on the air live. I have to tell you, I'm thrilled to be back on the air live. What I'd like to talk about today, Paul, is something called telomeres. It's a big word, but it really is something that we need to be aware of, because telomeres are like these shoelaces around our DNA, and the shoelaces have a little cap on them, right? And
Sure.
That's the cap. That's the telomere itself. So what happens is as they get worn, the telomeres get shorter and shorter, just like your shoelaces do. If the caps start to get worn, your shoelaces start to fall apart. Well, that's what the telomeres are. And interestingly enough, there's new data out showing that people, functional medicine people like ourselves and my physicians, are looking at these telomeres as a way to measure your functional age. Now, by that I mean not your chronological age, but functionally, where do you fall? Are your telomeres long enough? Because every time that your cells divide, and you can imagine what that's like, your telomeres are getting trifling shorter. Now, I want people to vision this in the micro, meaning a tiny. You can't really think of this you can't think of this not in the way we look at things in this physical world, right? In other words, shorter. We're talking about micro shorting. But what happens is these extra bits of DNA on the end of your chromosomes, this plastic cap, so to speak, actually starts to wear down. And when they wear down too much, that is a sign of aging. And there are ways, and most of these ways, believe it or not, have to do with nutraceuticals, which is exactly what we deliver in our bags, nutraceuticals, so that as the cells go dormant, as these telomeres get shorter and shorter, and the cells go dormant, most scientists think that's the best marker of a true biological age, not to be confused with your regular age. So maybe we should pick this up after our break.
Okay, that sounds like a
Great.
plan. Again, if you would like to call in and talk with Dr. Molly, and we do have a few phone calls already lined up. We'll go to
great.
after the break. Yeah, 855-839-1210. 855-839-1210. Use your cell phone. Verizon Wireless, AT&T callers, all you have to do is push pound 1210. Hey, we just talked a few minutes ago about calling Fran right now at Innovative Medical Associates. She's standing by to talk with you. You could give the office a call right now and set up that complimentary consultation at 856-489-0505. 856-489-0505. This is Health Watch with Dr. Molly Fantasia. I'm in the host seat this week for John DeMasi, another good friend of the program and another personal good friend. So if you would like to call in, phone lines are open. We're going to take a break, and when we come back, we're going to go to Frank in Northeast Philadelphia on Talk Radio
great.
1210 WPHT. Welcome back to Health Watch here on Talk Radio 1210 WPHT. Paul Perillo along with Dr. Molly Fantasia. Dr. Molly Fantasia, the PH.D. doctor from Innovative Medical Associates. We're taking your phone calls at 855-839-1210. As promised, we're going to go to Northeast Philadelphia and welcome in Frank to the program. You're on Talk Radio 1210. Hey there, Frank.
Well, Frank, I'm so happy to hear from you. How are you?
Well, I'm more happy to hear you. It's been a long time, Dr. Molly. You've been on
I
vacation
know.
for,
We believe me. And I'm happy to be sitting here across. John is here too as well. So it's very good to hear from you, Frank. How are you
John's
feeling,
here right
buddy?
now?
Yeah, he is. Say hello,
right.
John.
Right here,
there,
Frank.
Right there.
John,
Yeah.
glad to hear you all back. I almost had to be medevac because I was going through severe withdrawal with that Dr. Molly and Mr. John every Sunday for a while.
There you go. That's why. Hey, listen, he's resting, but you know what? He said, I can't do a Sunday without you, Dr. Molly. I said, well, you know what? I said I'm the luckiest gal around to have both of these fine gentlemen with me. So go ahead, my friend.
Because Paul Perillo is legendary in
Oh,
Philadelphia.
yeah, I
Every
know.
time.
Don't you
Thank you
know?
so
We
much.
know he's legendary, and I can count on him as a friend. So God bless us. All right. So
Anyway,
what's up, Frank? How you
Dr.
doing?
Molly, about a month ago, it was August 10th, I saw a naturopathic doctor.
Good.
And he told me all my problems pretty much coming from, he did a test called RM3A. Are you familiar with that?
Yes. Go ahead.
And he said, I don't remember everything, Dr. Molly, but I have all the paperwork, but of course I can't read it. What I remember is all my problems coming from poor venous circulation, which that was proven before with the arterial venous Doppler studies. There's too much sugar in my diet. There's too much preservatives.
Yep.
And it's caused everything backed up. But he told me eat alkaline. Also, and drink spring water. Make sure it says bottled at the source. Don't just buy something marked spring water, and make sure it has high pH in it.
Yeah.
Does it really matter?
Well, I'm going to tell you.
Spring water versus bottled at the source.
Well, I think many times it does, but I'm going to tell you something, Frank. I know a lot about this alkalinity business, and I know that you were trained, even though you're a very modest guy, you've been trained as a registered nurse, and you know that too much alkalinity is not a good thing. In other words, Dr. Molly prescribes to this view that we should be just right, not too much alkalinity, not too much acidity. So, in other words, I've seen people go on these alkaline diets and really move their body in a terrible alkaline state. And you and I know that that's not good, because then we run the risk of fungus, etc. And talking about, globally. Now, I do believe, though, there is some data to say slightly alkaline is not bad. So I think your naturopathic doc is on the ball. But Frank, you have some comorbidities, too. So you're not an easy case. And you're a very smart guy. I want you to do the alkaline diet, but I want you to be really careful about how alkaline you become. Does that make sense to you?
That's what I was thinking.
Good. That's
my
what I
concern
like.
is spring water. Does it have to say bottle at the source? He says.
Yeah, I think that is, in medicine. Now you've been around a long time in medicine. That's why they call it medical opinion. I think spring water is good because he's looking for the pH. The minerals, of course, would make the pH more alkaline. So that's what he's looking for. And I think you're smart enough to know where you can get bottled spring water. Okay, so I just don't believe that we have to have our patients spend $1 million outside the clinic. That's the bottom line. You know how I am. So, Frank, I appreciate this call, my friend.
Thanks,
Thank
Frank.
you.
And thanks for your kind words. Really do appreciate that. And he brings up a few different points there, Dr. Molly, one of which, just look at the bottled water industry today. I don't know. When I was growing up in South Philly back in the day, we used to drink water from the tap. That was it.
We called it the spigot, as I remember, right?
Yes,
Come
you're
on.
absolutely right.
Come on, guy.
You're absolutely right. So it was like, and that was our water source. And now, what a multi-billion-dollar industry that it's become. And he does bring up a good point because, oftentimes people are misled by labels, not only when it comes to bottled water, but with anything, because it's just a phenomenon in the world that we're living in today.
Exactly. And one of the things is, you'll hear as you continue to work with us that I'm always talking about nutraceuticals. It's the same thing. In other words, our vitamins, our minerals, there are good brands, there are better brands, and then there are lousy brands. Yeah. So it's like, you've got to be smart about what you do. But I can tell you that the water business is something that we looked at our clinic. And again, I want to use good water. I like people to go slightly alkaline, but I don't want them to go too alkaline. So I think Frank did a good job in bringing that to our attention.
The other thing, too, is in the commercial that we had a few minutes ago, and hearing John, speak about, do you have problems, just walking your dog? I think that drives home an important point because, here we have something as simple as going out and taking your dog for a walk, and then you have somebody like Frank who has a little more complicated situation. It shows the range of situations that a person might be experiencing. That's why they need to get themselves into your clinic, Dr. Molly. They need to, whether it's, just having problems getting up out of the sofa and walking to the door, or if it's a little more complicated, they definitely need to make that appointment to get in to talk to Dr. Molly and her staff at Innovative Medical Associates.
That's exactly right. And if we can accomplish anything, just come in for the free consult and John can vouch for that. Come in for the free consult. He's laughing here for the free consult because at that consult, I'm able to get a lot of information that may be able to help in your case. And I can tell you that we've helped people we've helped people through cancer care. We're supportive care in that, and we've helped people get through their chemo, their radiation, and we have some specialized testing that we can do and really evaluate where your nutritional status is, even going through some really, really terrible times. And honestly, I've got to tell you, one good thing about our facility is we get to see our patients once a week or so, and I'll tell you, it makes all the difference in the world because if someone's going through something and they don't even know they're going through it, like our dear John had a problem, okay, he's laughing, but he knows it's true. We got him the traditional help he needed in that moment. And that is something that we do and certainly separates us from going in and having a hangover remedy hanging for you. Okay? And I think that is a big difference. We are truly cooperative medical people who really are looking at our patients. The nursing staff is fabulous. I have wonderful physicians. They're great. They've actually come to me. One of my physicians has MS. She started out as a patient, and now she is one of our medical directors.
And she's looking fabulous.
All right, John saying
fabulous.
that. See? Okay. Not me saying it, and John saying it. So believe me, we handle all kinds of problems from the serious to the not so much. I was talking about the telomeres, but let me tell you something. There's nothing like utilization of hydration therapy to get the right mixture in terms of your nutritional functionality.
All right. We're going to take another break here in just a few minutes, and I want to encourage you to jump on board our available phone lines if you would like to talk to Dr. Molly and maybe even send some great wishes along to John, sitting there next to Dr. Molly, please do
Yes.
so. 855-839-1210. 855-839-1210. We all tend to take care of each other in this fraternity of ours, this broadcasting industry. So the fact that John is there helping Dr. Molly and Dr. Molly's helping John, that's what it's all about. And that's what you're going to experience when you get in to see the great staff and Dr. Molly at Innovative Medical Associates. They're located in Marlton, New Jersey. The phone number there, and Fran is standing by right now. We want those phones ringing. So Fran is busy there, and she could tell Dr. Molly tomorrow, hey, those phones were ringing off the hook yesterday. Give the office a call right now. She's there. She could set up that complimentary consultation, 856-489-0505. Again, the number is 856-489-0505. You can call the Innovative Medical Associates office. Also, you can find out more about the operation that Dr. Molly has going there at innovativemedicalassociates.com. Again, they're located in Marlton, New Jersey. We have Dr. Molly right up until the top of the hour. We're at the halfway point on this edition of Health Watch. If you would like to call in, talk with Dr. Molly, now's the time to do so. You know, you may think it's really nothing. It's just a small little problem. Or then it might be something that is bigger, and you're just afraid to take that step to make that phone call or get in to see Dr. Molly. Now's the opportunity to call in. You know, look, we're all human. A lot of us don't want to admit that we have a problem, and, you know, we're sort of shy about it. But, you know, that's why we do these shows. Health Watch is meant to help you. And whether it's a small problem or a big problem, call right now, 855-839-1210. Use your cell phone. All you have to do is push pound 1210. It's Health Watch here on Talk Radio 1210. WPHT. Welcome back to Health Watch here on Talk Radio 1210 WPHT. Paul Perillo along with Dr. Molly Fantasia, and we are welcoming your phone calls here, 855-839-1210. We love to hear from you. Also, you can give the office a call, Innovative Medical Associates, and set up that free initial consultation. Fran is in the office right now at 856-489-0505. You know, Dr. Molly, I think it's important, you know, while we're sort of getting reacquainted with, you know, with you, with the office, with the operation, sure, and as well as with me, and I think this goes to my point earlier, right before the break. Some people know they're experiencing some type of situation. It might be small, it might be big. And look, we're all human. We don't want to admit that we are having a problem. And perhaps the biggest challenge for us is picking up that phone and giving the office a call for whatever reason. I don't know. It's a headache. It'll go away.
Right.
You know, I got knee pain. I twisted my, you know, whatever it is.
Right.
But you need to pick up the phone. You need to get in, and you need to be seen by Dr. Molly and her great staff. Once the person picks up the phone and makes that complimentary consultation call, right, just walk us through what they should expect when they walk into the office.
Well, first of all, hopefully they're gonna be greeted well by our front staff, and I think that's absolutely going to happen. Secondly, even before they come to the office, Paul, Fran might ask them to bring any type of reports that they have. In particular, you know, the radiology reports, if they have it, any lab work they have it, and maybe they even have their name. We would like to get the names of their specialists, whoever's treating them in the moment. And then if when you come in, you get to meet with me. We actually sit in the conference room, which is pretty nice. You know, no one's gonna, and by the way, we don't hit you over the head to have you sign up. That's not what this is all about. This is an exploratory meeting to see if what we do by utilizing the hydration is a fit for you and can work for you and accomplish the task of improving your quality of life, no matter what the problem or challenge you have is going on, and that everybody's comfortable with the protocol and the game plan. So when you come in, you bring this, we'll sit down and I will go through this, and I would probably bring in one of the docs, or certainly if you speak to me on the phone before you come in, because many times, believe it or not, Fran ends up putting me on the phone if there's a case that she feels warrants that. So you actually get a free visit as well. So at that point, what will happen is we're going to go through all your data, and I'm going to sit down and get some important data to see where you are within the continuum of your particular case in your care. Some people do come in, like we were talking about earlier, the telomeres, they do come in for anti-aging, so they really don't have a challenge. But I got to tell you, and I would say that most of my patients and clients who are at the office would say, most people generally do come in with a challenge of some kind, a medical challenge of some kind. I'm seeing more and more people who are coming in with things like environmental medicine challenges, allergies to fumes, to sick building syndromes, mold, this kind of thing. I'm seeing more and more people who have cancer. I'm dealing with a lot more people post-stroke right now, okay? We see a myriad of challenges, but mostly during that first visit, I want to get a handle that what kind of protocols, the proprietary protocols that we have, will actually effectuate the change and meet the patient where they want to be, Paul, where they want to go.
All right. We have another caller on the line,
Great.
so here we go. We're going to talk with John in Marlton. You're on Talk Radio 1210 WPHD. Hey there, John.
Hey, John.
How you doing, Dr. Molly?
Oh, John, I'm so happy to hear from you, and so is John. He's giving me a big smile here, man.
John, I hope you're feeling better, John.
Yes, I am.
Yeah, he
Good,
sounds pretty
good,
good, doesn't he? Yeah. I tell you what.
Sounds like it. Stop running around with them young girls, John.
Hey, now,
boy.
hey, now, you know what? Hey, John, my John, your John, meaning you, John. John, listen, if he stops running around with these young girls, I may have more problems on my hands with him, right? Come on.
Well,
That's the whole point of
I
coming
called
to
about
us,
is
right?
This, but what I called about, Doc, is this bit about your chronological age and your regular physical age. What is it you do about that? Could you elaborate on that?
Yeah, sure. I would love to. One of the things is one of the reasons why this came up, John, is that there was a big scientific study done on Mark Kelly, who was the astronaut who was up in space for a year.
Right.
Well, he was a twin, and his brother and him. So NASA's scientists, and by the way, I knew one of the physicists there. This is how I got a hold of the study. And he actually went to Temple, which I'll give him a plug, right? Temple's a plug. Mm-hmm. Here's the thing. They did the study on Mark, and they thought that when he came back, because of he lost some height, if you remember, it was all over the paper,
right,
that he lost some inches, and he had big dysregulation in his gut, okay, because he didn't take the probiotics that we tell you to take, right? Mm-hmm. But the interesting thing, John, was his telomeres, or those caps on the shoelaces around his DNA, actually lengthened. So they did not shorten like they expected it to do, which would mean it would give him a physiological or biological age less or a lot more than his real age as compared to his brothers. But guess what? It didn't happen. So then they had to look at why wouldn't that happen? And guess what it was, John? Guess what it was? Exercise.
Yeah.
So more because they're on a vigorous exercise regime as well as diet. They were taking a very stringent diet in space, and it was high in, guess what else? Antioxidants. So even though they were those pre-mixed meals, I guess, that we know about, like Tang came from there and all that jazz, they're high in antioxidants. So what happens is these antioxidants work on a particular polypeptide that really is part of the telomere, and the antioxidants have helped this to make sure that they could rejuvenate his telomeres, or those shoelace strings and the caps. Isn't that something? It was amazing.
Yeah, the polymeptides. I had read something about that before, and that is an anti-aging agent, isn't it?
Yes. And I use, by the way, polypeptides, as you know, for lots of things. In particular, I use it when we're using things like the PRP, when we want to help you with tears in your knees or whatever, and those kinds of, and of course, utilizing the MSC cells, those kinds of things. But it's so interesting. And the other thing is, guess what his diet was heavy in? broccoli. And broccoli, believe it or not, broccoli has a tremendous antioxidant effect, and it has
and
a
it's real good with
sulfur.
shrimp and broccoli too.
That's true. Hey, the way you make it, John. Come on. And you know what? We should say something to John. You know, John went fishing with his granddaughters. John
I'm
is
going again.
Nice.
I'm going again.
Oh, you're going again. Good. How many
Thursday.
granddads can go? And by the way, his granddaughters are beautiful and smart. God bless them. So, I mean, you know, John is a good example of the kind of patients that we have that come to our facility, in that they're worried about their health, but they do something about it. And honestly, I can't thank you enough for making the call, John. I really can't, because we want our John back.
Take care and God bless.
God bless you too, John.
All right, John.
That was a
Thank
nice
you.
call.
Yeah.
Thank you.
And,
Thank you.
Maybe he would invite us over for some of that shrimp and broccoli,
yeah.
Dr. Molly.
I'll tell you what, it'd be a
good.
let me tell you something, Paul. It'd be a treat because he's a heck of a cook. And John, you know, I like to tease John because he was a barber, and you know, in the old days, barbers were considered small doctors, right?
Yeah.
Because they
Yeah.
were doing so much stuff. But he's a very smart guy, and I can't tell you his age, but I can tell you he's in his 80s. Okay,
Wow,
and he
God bless
doesn't
him.
sound
Yeah.
like it, and God bless him. He has a real joy for life, and I think, if anything, that's the other thing you're going to find in our facility. People want people to have a good quality of life. We're coming up on another break, right, Paul?
That's right, yeah. And that's really what it's all about, good quality of life. And that's what you're going to find when you get yourself in and get yourself checked out at Innovative Medical Associates in Marlton, New Jersey. You know, make that appointment right now. Fran is standing by at the office, taking your phone call. Set up that free initial consultation at 856-489-0505. Again, 856-489-0505. We have Dr. Molly and John Fantasia, John DeMasi with us. I'm sure, John, how many times does that happen?
Many.
He's
So we have them right up until the top of the hour. And my name is Paul Perillo. I'm just filling in for John here for a few weeks till he gets back on his feet. But we're so glad that he is with Dr. Molly right now.
Thank God.
And we are talking about all the great work that Dr. Molly does and her staff at Innovative Medical Associates. Again, that office number is 856-489-0505. One more segment straight ahead. If you want to get in and talk with Dr. Molly, our phone lines are open, 855-839-1210. Verizon, wireless, and AT&T callers. All you have to do is push pound 1210. This is Health Watch on Talk Radio 1210, WPHT. Welcome back to Health Watch here on Talk Radio 1210, WPHT. Paul Perillo along with Dr. Molly Fantasia, the PhD doctor. And I want to give out the website again because, you know, I found myself on the website a few times in the past week or so. It's a great website. Also, previous radio shows from Talk Radio 1210 WPHT, previous editions of Health Watch are posted right there on the website. So you could go at your leisure and listen to these shows. They are very informative. You're going to learn so much stuff in that they're all there. They're for your browsing. You might want to start. You might want to go back. You might want to skip ahead, go back a few, whatever you want to do. But the website is, and jot this down, InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com. The office phone number is 856-489-0505. Dr. Molly is with us right up until the top of the hour. And we've just only sort of scratched the surface, if you will, when it comes to the services that her office has to offer you. And, you know, whether it's you think it's a major issue or a small issue, the staff and Dr. Molly are there to help you. And, you know, we talked a little bit about medical hydration, you know, cancer care. You know, a lot of people, when they hear that word, Dr. Molly cancer, they go into a state of free fall. They just go into a state of panic. But there have been so many strides that have been made with cancer care that, you know, we sort of, I don't want to say we've come to embrace the word, but, you know, at one time, again, I know growing up and we had family members that were diagnosed with cancer, it was sort of a death sentence. You know, it was just like, you know, they just died from cancer. But today, there are so many
breakthroughs. There are, Paul.
Exactly. Yeah.
You're right. You're right. And let me tell you something about what we do. one of the things we do is we want to support people. I have people in our facility who choose to go conventional route. Well, my job then is to support them while they're going through the conventional route. I also have people, by the way, one of my good friends of the clinic, Pam, who had unfortunately was diagnosed with cancer. She decided that she would do the surgery, but she didn't want to do anything else conventional, and has been with me for I can't tell you how many years, but many years. And there are people in my facility that want to do both, and we applaud them. And I will tell you something else that we do. Because of the length of time that we've been doing it, and because we are not so against conventional treatment, we've actually had the ability to help people find other physicians who may be able to better address their particular cancer, also allow them to get second opinions on things like their biopsies. And, we have the ability to do this because we are a licensed primary care facility. So again, just the part of our facility that is sort of concierge in nature, meaning we're able to be involved in your care, get you to the right people, possibly, and help you through the cancer journey. And I think that that's important for people to know, that we are not so vested in one way or another, but we're actually more invested in the patient, period. So and thank you for bringing that up, Paul. It's important. It's important. Yeah. Thank you.
It seems the past 2 years plus we've been living in this pandemic world that we've been involved in, and a lot of people, haven't been getting out much, and they're sort of scrambling for answers and where to go and what to do, and they're afraid to go here, they're afraid to go there.
Right,
and every day
right.
there seems like there's another set of guidelines that are coming down as it pertains to, how has the office, Dr. Molly, how has Innovative Medical Associates sort of responded to the scare of the pandemic that still persists out there?
Oh, it's terrible. And I will tell you, you're absolutely right. It's so confusing, our patients. And we have a lot of patients, by the way, who have comorbidities, so that they're even more confused by the guidelines. But one of the things I would say is we have a wonderful COVID protocol that we help people through the COVID itself while we were in the throes of the pandemic, even though, we followed all the necessary regulations about keeping the facility hygienic, but beyond that, we really were involved in that, and the post-COVID protocols have been unbelievable. I have a young man patient, Tim, who actually I sent him to the hospital. He come to the office, but we sent him to the hospital, and he was a patient prior to the COVID, and I'll tell you what, he got through the COVID, and his pulmonologist is telling him he shouldn't be here. And I knew that was true, but I would tell you that the fact that he was our patient prior to the COVID, meaning, and a faithful one, he was in my office at least once a week for a protocol that included helping his lungs. He made it through there without being intubated, and they said he was a hair away from being intubated. He is now doing the post-COVID. He still has some problems. This is not holy water. We can't make you, walk on water either. But I will tell you, if you look at Tim today compared to where he was, he's doing great. And I have many other success stories on the post-COVID protocols that we are using. So, it
makes perfect sense that you need to pick up the phone and you need to get in to see Dr. Molly Fantasia, 856-489-0505. Get in. You owe it to yourself. We are so busy worried about everybody else and every other thing that's out there. You owe it to yourself, Dr. Molly, right? Do you not?
I think it's absolutely true. Look, and even if you come in to see me, look, John's sitting here, so I'm going to use John, and he doesn't mind me using him as an example. Our John was in our office every week. Now, Twice a week. He just corrected me. Twice a week. He was in our office every week, twice a week. And again, he had comorbidities. And again, I've said that to everybody all the time when he was on the radio with me. He had comorbidities that were serious. And one of those comorbidities crept up because we thought he was following what we told him to do at home. We knew what we were doing in the office, but he wasn't quite doing that at home. But I really can tell you that the fact that I knew him so well absolutely played into the fact of why he's sitting here today. And my physician said that as well. My medical director said, Molly, bottom line is, by rights, John shouldn't be sitting across from you, but you did a good job with him when you pushed him to do what you did and take him to the hospital. So the bottom line is people are in good hands at our facility. So thank you, Paul. This has been great. John? We
just have a few minutes left, and I know John wants to throw in a few things here. So, John, go for it.
We want to thank all of our staff.
Right.
And for Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nurses, Barbara, Lana, Catherine, and Jess, and delightful Dee. We have Joanne, and our medical assistant, Karen, Kathy, and everyone at Innovative Medical. Thanks for listening. We'll talk to you again next week. We'll be here 8 till 9 right here on Talk Radio 1210 WPHD.
Thanks, Paul Perillo, for doing such a great job. God bless you all.
Dr. Molly. Thank you
hear
so
me?
much.
God bless you all. Thanks.
Thank you.
Thanks, Jim, our engineer. God bless you.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.